So the government's just brought in an ordinance which aims at protecting healthcare workers, because in the last few days, we've seen a whole stream of cases coming in from various parts of the country, doctors being attacked, whether they're going to collect samples. In just discharging their duties, they've been attacked. So joining me now, Dr. Sumit Ray, who's in charge of the ICU at Artemis Hospital. Thank you, Dr. Ray, for speaking with Hindustan Times.
Thank
Just
you.
explain to, this has been something, I think in a way the government has just averted a crisis, because the Indian Medical Association was threatening to go on a strike, and this move seems to have averted that. But do you think in the corona fight, this was topmost in priority for healthcare workers like yourself?
Well, I don't think so. But having said that, first of all, I condemn all violence against all healthcare workers. And that is unfortunate and that should not happen. But I have a couple of questions about this. One is that why is it only in certain places that you see this violence against doctors or healthcare workers, not just doctors, ASHA workers? We shouldn't forget that they are facing much more violence than doctors, actually, many times. Healthcare workers going out and taking samples or contact tracing, etc. So why doesn't it happen in a state like Kerala? And why does it happen in other states? I think that answers the question. And the fact is that if people, different social groups, communities, etc., have a faith in the healthcare system of that state, then they don't go out and beat up the healthcare workers. It is only when there is a lack of trust and faith in the system, in the governance and the system, that you have this kind of violence. It happens also because of the fear that this COVID infection can stigmatize them, ostracize them, isolate them in many ways, and be a way of surveillance on them. All these fears probably add to the idea that that these healthcare workers actually are representing the state, and that's why the probable violence. I'm not justifying, I'm not saying that it's the right thing to do, but probably to understand these attacks, it's important to understand these facts.
Well, that's like a deeper problem.
Right.
And what you're saying means that we will probably not see these attacks go away with the ordinance. Is that what you're saying?
Well, to a certain extent, certain rules, laws, etc., may reduce the violence at to a certain extent. It may or will. But also the other point is, I have always had a problem with the healthcare. It's not the first time that healthcare workers are being attacked in this country. Yeah, COVID or no COVID, medical healthcare workers have been attacked before also. But we as healthcare workers should not look at ourselves being at war with the people of this country. A law like this brings in an idea as if we are at war with the people of our own country. Why doesn't it happen in Italy or France or NHS, where many more people are dying of coronavirus, right? But it doesn't happen there because there is a trust in the healthcare system. It's a more equitable healthcare system. It's a good quality public health system which people believe in. When a healthcare system does not seem to be made for people, when they do not have trust and faith, as I said before, and certain communities feeling that they are being ostracized or stigmatized or isolated because of this, that is when we see more violence.
I wanted to ask you, one of the top stories that have been, my colleagues have been covering in the last few days has been the tests failing. What do you think, and this is something that the government has to kind of respond to. They're saying that, look, there were problems. We are now recalling the tests, but various states, whether it's West Bengal, Rajasthan, they're saying that they're having huge problems with the rapid test kits. Where do you see the problem?
Well, I think it's the quality of the test in the rush to make these kits. Obviously, the quality control hasn't been very good. So that is what has to be checked before we put these tests out anywhere. All these tests, the RT-PCR tests before this, there has to be quality control. And these are the antibody tests, and there has to be quality control. There has to be checked before are they actually giving the kind of positive and negative results, how high are the false positives and the false negatives, and only then can we really put it out into the community and test people. So there has to be a check on the quality control is most important.
You must be in touch with various people in your community of doctors. What are you hearing about PPE kits? Do they have enough? Do doctors have enough? And where do you see the shortfall?
I don't think, if you look at the whole country, and we have been in touch with people, there is a shortage of PPE kits. In my hospital, we kind of realized and planned a little early, so we built up stocks slowly, steadily. It was difficult. Initially, it was very difficult. We are starting to get it a little more easily now. But obviously, the initial problem was that it was not kind of, uh, nobody had planned that there would be such a high requirement, and the criteria of what a good quality PPE is and what is the material required, how much material would be required, because most of these the basic material on which the PPE kit was made used to be imported. So somewhere probably there was a delay in acquiring the material, because stitching and making it may not, we have the textile industry to a large enough textile industry to probably stitch and make it, but the basic material is become the main problem.
Speaking as a doctor, if you had to tell the government that this is what we need, not just they've done the ordinance, but if there's something that they could do in policy or legislation that would immediately give relief to all the doctors fighting corona, what would that be?
See, I don't know if it requires a legislation or not. I just believe that, providing good quality protective equipment, good quality facilities, not just doctors. And I want, this another thing, that there's this hierarchy in medicine that, even if you see in Delhi, doctors are being kept in five-star hotels,
Yes,
are working, and the nurses are not, and not just that, the people who are cleaning, which is a extremely important part of healthcare, is sanitation, the cleaning of the hospital, etc., the beds, etc. They are such important workers. The kind of facilities they are getting, the kind of facilities the nurses are getting, and the kind of facilities doctors are getting are absolutely different. And that is something which is unfortunate, because everyone's role is important. And also, interestingly, probably nurses are much more in contact with patients than sometimes doctors. Yes, doctors are, younger doctors, particularly resident doctors, etc. So getting good quality kits, getting good, ventilators, etc., which will be necessary in the near future as the numbers surge, monitors, syringe pumps, all the requirement for the ICU, what you require for a critically ill, is what the government should focus on, and the supply chains based on that. Uh, Violence, probably more than any ordinance, etc. It is to reassure people that that yes, we will take care of you. Our role as a government is to take care of the people of this country. We don't, you know also this building up of the stigmatization that has happened by almost making this virus almost like a devil virus, and that has happened in many pandemics before. When we really up the ante on making this virus look so dangerous, that people who get stigmatized or ostracized. And there is also vigilantism that you see, vigilantism against healthcare workers also, who stay in buildings with other people. So that has to come down. There has to be a calming down also by the government of the, yes, data is important, surveillance is important, looking at things where the contact tracing, all that is important, but there has to be a calming down of the situation also, so that this kind of vigilantism, ostracization, and stigmatization is not there. That is should be the main, also one of the main focus.
Well, thank you so much for taking out time. Thanks very much for speaking with us. Thanks.